Hi, everybody. I'm Dr. Brian Ardis, host of the Dr. Ardis Show. I am Dr. Ardis. This whole show is going to be about a condition that affects millions of people around the world, actually, that makes them wonder why it is their heart's racing, they feel anxious, why they can't gain weight. There are people that worry about that. And so we're going to be diving into all things hyperthyroidism. Hyper, meaning it's over producing hormones and it's making people feel anxious, fatigued, wiry. It has a lot of symptoms associated with it. And then there's a condition where the human body itself will produce antibodies that will attack the thyroid while you have an over functioning thyroid. And that is called Graves' disease. So we are going to be taking you through what the medical profession tells you about hyperthyroidism, what your endocrinologist most likely is repeating to you that they learned in med school about hyperthyroidism. And then I'm going to show you what are the drugs most commonly prescribed for this condition affecting millions of people worldwide, and what are the proven from medical research studies natural antidotes that often reverse hyperthyroidism. And I'm going to show you statements in research studies where literally the entire condition is reversed all naturally within just a few weeks. Sometimes even in the pets of patients with hyperthyroidism, they'll give the same natural products to their pets and reverse their thyroid conditions too, which is pretty miraculous. You are a natural being. You require natural solutions. So that's what this whole Dr. Ardis show is about, is hyperthyroidism and the natural antidotes to that condition. So if you know anybody who has bulging eyes where you can see the whole pupils, that's called orbitopathy, that is associated with hyperthyroidism, where you see the whole eyes, the whole circular part of the iris of the eyes. You can see all of it. Most of us, you can see the eyelids covering the bottom and top parts of your iris. But you've seen bulging eyes on people with hyperthyroidism. What else is associated with that? Goiters, enlargement of the thyroid. You can physically see it in some people. So if you know anybody who is suffering with hyperthyroidism, this is for them. If they have an overfunctioning thyroid, this entire presentation is for them. And I'm very excited to share some of the things I've learned and done research on hyperthyroidism, of which any of you that ever met my wife, she actually came to me as a patient, is how I first ever met her over 15 years ago from the point of this recording. She actually was misdiagnosed as a hypothyroid patient when in fact she was a hyperthyroid patient. But when she was misdiagnosed as a hypothyroid patient, they put her on Synthroid and levothyroxine, synthetic thyroid hormones, because supposedly her thyroid was underfunctioning. And when she was really, truly a hyperthyroid, and the medical professionals missed it. So when they put her on Synthroid, immediately within a month or two, she's now being diagnosed with high blood pressure. Why? She already had overproducing thyroid hormones that they missed in reading her blood report. They gave her more thyroid hormones. The thyroid has a dramatic impact on the heart, which is why overfunctioning thyroids like hyperthyroidism create heart symptoms like palpitations, anxiety, and panic. All we had to do is get her off the drug Synthroid and then give her trace minerals to reverse it. And she hasn't been on any of those drugs and came off her high blood pressure drugs within just a few months of me meeting her. And that was over 15 years ago. So those same principles I used to help address my wife's own thyroid issues that she was misdiagnosed for, overtreated for, that created more problems and more prescriptions and visits to a cardiologist she didn't even require. She didn't develop high blood pressure till they gave her too much thyroid hormones on top of what she was already making. So you're about to learn what I've been educating people all around the world and in my practice about thyroid conditions. This one is specifically hyperthyroidism. So let's dive in here. You're going to see on the screen a PowerPoint presentation, Hyperthyroidism and Nature's Antidotes. All right, on the screen, you can scan the QR code, put in your email, and you'll get notified of when every week when I'm releasing a new presentation on a health topic of my choice, or from others on our team, or from you at home. You can write into info@thedrardisshow.com and propose things you want us to write on or produce a presentation on. Now, just remember, if I get a flood of these, if I get 1,000 of them, I only do one of these shows a week on top of all my other interviews and travels around the world at speaking at events. So I will get to them. Just remember, it's one topic a week is what I do. And this week is hyperthyroidism. Scan the QR code if you'd like to learn more. All right, let's dive into what is hyperthyroidism by definition per the medical establishment. All right, hyperthyroidism, per the Mayo Clinic, is an overactive thyroid. Hyperthyroidism happens when the thyroid gland makes too much thyroid hormone. This condition is also called overactive thyroid. Hyperthyroidism speeds up the body's metabolism. When I mentioned earlier that many people struggling with hyperthyroidism can't put on weight, they're trying to, it's because their metabolism is revving too high. Sometimes hyperthyroidism treatment includes surgery to remove all or part of the thyroid gland. That's not how you cure a thyroid problem, by the way. Taking it out is not curing anything. But anyway, it's very commonly what they do. All right, according to the American Thyroid Association, hyperthyroidism has these symptoms, as you see on the screen. You can go to thyroid.org to learn more if you'd like. Did you know thyroids, this little bitty gland in your neck, has its own website? It's amazing. This is thyroid.org. I wonder if liver.org has its own website, or pancreas.org, or appendix.org. I wonder if they all have their own website. That'd be funny. All right, so what are the symptoms of hyperthyroidism? Increased sweating and feeling hot, feeling like your heart is racing or is beating irregularly, hand tremors, anxiety, nervousness, irritability. Also, hyperthyroidism includes weight loss despite normal or even an increased appetite, frequent bowel movements or diarrhea, difficulty sleeping, hair loss, changes in menstrual periods, often lighter and or less frequent, trouble swallowing or fullness in the neck, increased or decreased energy levels, pain behind the eyes and or swelling or bulging of the eyes for autoimmune thyroid dysfunctions. Here's where the thyroid is. You see an image of it on the right, second circle on the right. That's your thyroid, sits at the base of your neck. And you can see the different organ systems of the body that are affected by an over functioning thyroid. So you'll see the heart has issues, the hair has issues, the brain has issues, the gut has issues, your fingernails and skin have issues, and muscle cramps and other issues. I mean, what part of the body isn't affected? Hormones are very important. According to the NIH, the National Institutes of Health, hyperthyroidism, an overactive thyroid. Let's learn how common this is. About 1 in 100 Americans aged 12 years old and older have hyperthyroidism. I just want y'all to understand something. When you look at statistics on diseases in America, 100% almost of everybody is diagnosed with some medical condition. This only favors the pharmaceutical industry, by the way. 1 in 100 people in America now, over-functioning thyroids. You're all being poisoned with your food, air, and water, drugs, you name it. You should stop poisoning yourself. These are all the symptoms of poisoning and the reactions in our bodies to such. Hypothyroidism is more common in women and people older than 60. You are more likely to have hyperthyroidism if you, number 1, they say, have a family history of thyroid disease. Not true. Have other health problems, including pernicious anemia, maybe. Type 1 or type 2 diabetes, for sure. Primary adrenal insufficiency, definitely. It's not a primary adrenal insufficiency. A hyperthyroid patient's thyroid is overactive, and it's producing too many hormones that exhaust the adrenals that produce adrenaline, norepinephrine, you name it. Cortisol. If you have an overactive thyroid, it's like an overburdening, micromanaging boss of yours. He's going to wear you out, just like an overactive, micromanaging, overwhelming thyroid is to the adrenals. And it will lead to chronic fatigue and adrenal fatigue. They also say hyperthyroidism is also more indicated and more common in those who eat large amounts of food containing iodine. Well, iodine does feed the thyroid. That is not the number 1 cause for hyperthyroidism. Not enough of you are getting it. Use medications that contain iodine. I guess that could be true. Use nicotine products. That's awesome because I have research on nicotine patches reversing hypothyroidism and hyperthyroidism dementia. Isn't that amazing? And then we're pregnant within the past 6 months. Now, there are chemicals in tobacco products, I would warn you, can have a huge impact on the thyroid, but that isn't the nicotine part of the plant. Drugs.com. These are the common medications your endocrinologist would recommend to you if you were diagnosed with hyperthyroidism or had any of the symptoms I just named. Drugs used to treat hyperthyroidism. We have had highlighted on the screen the 2 most commonly prescribed drugs for hyperthyroidism if you went to your endocrinologist or a medical doctor it would most likely be one of those two drugs. You'll see tapazole, I don't even know how to pronounce this, propylthiouracil. How about that? But you'll see the other ones: methimazole, potassium iodide, ThyroShield, Hycon iodine, which they just said could be contraindicated in hyperthyroidism, but they might prescribe it to you. Sodium iodide, iodine with salt. Lugol's iodine, another iodine source. Isn't that funny? They tell you that too much iodine can create hyperthyroidism, but they know there's 3 of them listed on here, iodine sources. The Cleveland Clinic, hyperthyroidism. Anti-thyroid medications, including the 2 we just highlighted, methimazole, tapazole, propylthiouracil, PTU, block the ability of your thyroid to make hormones. These medications are the most common treatment for hyperthyroidism. I repeat, these are the most common treated drugs for hyperthyroidism. They can usually control thyroid function within 2 to 3 months. Wait till I show you research studies on some simple minerals that within 2 to 4 weeks do it. What these drugs actually do that are prescribed most commonly for hyperthyroidism. Here's methimazole, maybe that's how they pronounce it. You see a picture of it on the right at the top, otherwise known as brand name tapazole. All right, so here we go. Look at the liver side effects named hematologic of this drug for hyperthyroidism. Lymphadenopathy, swollen lymph nodes all over your body. Thrombocytopenia, that's blood clots in your brain. Aplastic anemia, horrible. Hypoprothrombonemia, that means you can't make blood clots. You can't clot blood anymore. You're going to hemorrhage to death. All right, so let's skip down to this. They have this highlighted, as you see, the first red box at the top, frequency not reported is the category. And I want to remind all of you from our previous presentations, if this is the first time you've watched the Dr. Ardis show, someone knows you have hyperthyroidism and sent this to you. I want to read to you what the definition of frequently or frequency not reported on drugs.com for all drugs. When they list frequency not reported and then all the side effects that they name have been reported on the drug, you need to know what this means. If a side effect, I'm quoting from drugs.com, if a side effect has the words frequency not reported, then this means that neither the product information nor clinical trials have specified exactly how many people have experienced this side effect for this particular medicine. So it's not that it didn't happen to the majority of people or just a couple people. No one ever turned over the number of people that were affected with this condition or side effect. No one decided to tell you the number of the group in the trials. So if they had 100 participants, they're not going to tell you how many had lymphadenopathy. They're not going to tell you. They're just going to say frequency not reported. They didn't tell us. Sometimes, I'm continuing here, side effects are not reported until after a drug goes to market. When this happens, there's no way to know how many people have experienced this side effect reliably. But they do know all of these are published side effects at the top, published as a side effect of this drug for hyperthyroidism. Now let's look at frequency not reported. Did you know that the drug tapazole for hyperthyroidism, it causes lupus-like syndrome? Did you know that? But they're not going to tell you how many people. They just know it does that. So when you have someone who's diagnosed with systemic lupus erythematosus or lupus, and prior to that diagnosis, they were put on a hyperthyroid drug, ask your doctor if the drug they prescribed you could have possibly been responsible for the known reported side effect to create lupus-like symptoms, which includes joint pain, rashes all over your body, blisters, diarrhea, irritable bowel symptoms, you name it, but primarily rash, joint pain all over your body. That's a side effect of that drug. It's also published to cause jaundice and hepatitis. Who doesn't want more inflammation of their liver? What about skin-reported symptoms and side effects of tapazole for hyperthyroidism? Skin rash, urticaria, abnormal loss of hair, balding, a good idea for all of you with hyperthyroidism. I have a thyroid problem, doc. I have a goiter enlargement and I'm losing my hair. Well, let's give you this drug that even makes you lose more hair. Skin pigmentation changes. I don't know. You ever heard of vitiligo? Did that start after you were put on this drug? Because it causes it. Now let's read an experience of this drug being given to a pregnant woman. Not even a pregnant woman. All right, here we go. A 5-year-old female experienced aplasia cutis congenita coincident with in utero exposure to the drug methimazole, otherwise known as tapazole. She presented with hairless scars on her scalp, the 5-year-old. At the time of conception, her mother was receiving therapy for Graves' disease, hyperthyroidism with autoimmunity, being given while pregnant 20 milligrams daily of methimazole. And the 5-year-old has scars all over the scalp from where they can't grow hair. Interesting. Ask your doctor if this drug's right for you and your baby. Cardiovascular-wise, side effects of this drug: edema. Anybody want swollen legs, ankles, feet, toes? Periarteritis, inflammation of all the arteries in your body. Arthralgia, myalgia. Anybody want joint pain all over your body? This drug will do it. If you want pain all over your body, ask your doctor for tapazole. What about GI symptoms, side effects? Did you know this drug for hyperthyroidism causes nausea, vomiting, epigastric distress, upper stomach pain, and then sialdenopathy? I actually had to look that up. Y'all can look it up. I had to look it up, but I don't remember what it was. Anyway, I looked it up a few days ago in preparation for this. Case reports for recurrent acute pancreatitis with a decreased time to onset after re-exposure to the drug have been received. Pancreatitis, anybody? You want to end up in a hospital with pancreatic pain for weeks on end, being pumped full of morphine? Well, this drug can cause that. Nervous system, paresthesia. Oh, loss of symptom, like loss of sense of feeling, loss of taste, headache, drowsiness, neuritis, painful nerves. That doesn't sound good. What about other vertigo? Anybody want vertigo? If you have hyperthyroidism, you want to throw some vertigo on there? Oh, and then look at drug fever is another known side effect. Did you know that drugs can cause fever and the drug itself induces fevers? Did you know that? Actually, just so you know, in preparation for this, my son put together this slide for me, going through these things. He did a great job. I told him, I said, drug fever is a side effect. That's a new one on me. I still had never seen that. Of all the drugs I've studied for 25 years now, I've never seen that side effect till this one. Now, this is the other drug most commonly prescribed for hyperthyroidism per the Mayo Clinic, per the Cleveland Clinic, and that's propylthiouracil. And you'll see it on there to the right. You see the picture. Let's learn a little bit more about its side effects. Oh, it comes with an FDA black box warning, everybody. I hope your MD told you about this. But if you're put on this propylthiouracil for hyperthyroidism, did you know that, read it along with me, severe liver injury and acute liver failure, including, have been reported with propylthiouracil. Liver transplantation was required in some cases. Well, I don't know about you. Does that make you angry? Does it make you angry that millions of people are being prescribed propylthiouracil as the most common drug, one of the two most common drugs for hyperthyroidism, and they know it can cause acute liver failure that includes death? Not from hyperthyroidism, from the prescription you got at CVS and Walgreens from your medical doctor who cares about you so much and doesn't do their own research. Or at least doesn't care to warn you if they knew the research. If you know, and the drug company. Can't sue the FDA. They told you. Look, it's on drugs.com. They told you might. We put it in print somewhere. You just had to find it on the Dr. Ardis show because you're not willing to go look. Up to 10% of all people, that's 1 in 10, being prescribed this drug, most commonly given to hyperthyroid patients, asymptomatic liver function test abnormalities. Liver starts to die or get inflamed or diseased. Increased bilirubin, ALT, AST, which are reversible on dose reduction or discontinuation of the treatment. Okay, the drug does it. Obviously, it's not hyperthyroidism, because if you take them off the drug, the liver goes back to normal. You'll see under frequency not reported, liver injury presenting as hepatitis, liver failure necessitating liver transplantation, liver necrosis, and liver failure. Liver injury resulting in liver failure presenting as hepatitis, liver failure necessitating liver transplantation or resulting in death has been reported with propylthiouracil when prescribed for hyperthyroidism. Cases of liver injury reported in women during pregnancy. What? 2 reports of liver failure have been received in newborns exposed to this drug. This is an FDA-approved product. Look at the liver, hematologic. Sorry, that's blood. Look at the blood stuff. Hypoprothrombemia. Prothrombin is what makes blood clots. If you can't coagulate blood, you'll bleed to death with a simple wound. You'll just bleed out or you'll hemorrhage. Lymphadenopathy. Anybody want lymph nodes that swell so you can worry about having cancer sort? What about your immune system? Did you know that propyl thiouracil for hyperthyroidism causes vasculitis syndrome, lupus-like syndrome, including an enlarged spleen called splenomegaly, and sialadenopathhy. I'm sorry, I can't remember what in the world that was. I'd have to go look that up. Vasculitis, inflammation of your veins, vasculature, resulting in severe complications and been reported from propyl thiouracil. So not only liver failure causing vascular problems leading to have occurred with this drug. Ask your doctor if it is right for you when they offer you or your loved one propyl thiouracil. GI problems, increase of or decrease in urination. What about musculoskeletal? Periarteritis, inflammation around your arteries. Arthralgia, pain anywhere in your body. Myalgia, pain in all the muscles of your body. Just so you know, you take myalgia and arthralgia, that's what fibromyalgia is. Just combine them both. So both of these, fibromyalgia could be the side effect of getting this drug prescribed to you. Arthritis, myopathy, that's diseases of the muscles, even of your heart. And then backache. Who doesn't want backache? It's because it's causing liver failure, and the liver flanks around to the back, and you'll have referred pain. Nervous system, paresthesias, loss of senses of nervous system, loss of taste, taste perversion, headache, drowsiness, neuritis, vertigo, dizziness, encephalopathy, swelling of the brain. That sounds great. And then numbness of tingling of fingers, toes, or face, and cerebral angiitis. Sounds great. Inflammation of your cerebral part of your brain. I love it. All of this sounds great. Sounds better than just having an overactive thyroid, doesn't it? Doc, I'm nervous. I'd prefer that you prescribe me something with my anxiety that you called hyperthyroidism, and please give me 2 drugs or 1 drug that causes liver failure, vascular failure, cardiovascular failure, and swelling of my brain. So ridiculous. If you don't find that ridiculous, I'm sorry. I do. I find it especially ridiculous because none of y'all even knew this stuff. I guarantee it. But we find it and we show you. Skin reactions to propyl thiouracil. Exfoliating dermatitis. Peeling of your skin, just sloughing off. Isn't that gross? Abnormal loss of hair, pruritus, redness of your skin. Skin pigmentation, increase or decrease. Vitiligo, anybody? Dark patches, anybody? Lightening of your hair color. Your hair going gray, losing your color. Lymphadenopathy, mild papular skin rashes. Oh, it's just ridiculous. Let's go to the eyes. With the eyes, watery eyes, sore eyes, red eyes, conjunctival disorders. Well, what does that include? Pink eye. Renal. This is kidneys. Acute glomerulonephritis. Kidney failure. Thank you. That sounds wonderful. That's better than just having an overfunctioning thyroid, isn't it? Kidney failure, liver failure. This is why the backache was listed earlier. Your kidneys are right up next to your back. So yeah, if you're having kidney failure or inflammation, you're going to have back pain. Respiratory, pulmonary hemorrhage. Oh, did y'all know that? Did you know you could bleed out to the lungs and cough up blood out of your mouth, and is a published, known, reported side effect to propyl thiouracil? Does that sound better than a overactive thyroid leading to constipation and diarrhea and hair thinning, maybe? Bulging eyes? Is it better to bleed out in your lungs and try to breathe through blood? Enough of that crap. Those are just the 2 most common hyperthyroid drugs prescribed to people when they're diagnosed with hyperthyroidism. And just so you know, from the time anybody has been diagnosed with hyperthyroidism and put on any of those 2 drugs, if any of them have any of the problems I just named that are published side effects of the drug since they first went on those prescription drugs, you should talk to your medical doctor and your loved one about getting off those drugs. Those drugs are poisons causing liver failure and death. Requirement of liver transplants in people. It's making their brain swell, leading to encephalopathy. It's creating strokes in the brain. Blood-brain bleeds. Ask your doctor if all those symptoms are right. Ask them if acute kidney failure is right for you. Now it's time to dive into what are the published antidotes for hyperthyroidism and Graves' disease. You cannot have Graves' disease without hyperthyroidism. You can have hyperthyroidism without Graves' disease. But in both cases, hyperthyroidism is included. So you're going to see some of these research studies where we're talking about Graves' disease and the hyperthyroidism that accompanies it. You can be hyperthyroid and not be Graves' disease, but you cannot be a Graves' disease patient and not be hyperthyroid. The designation Graves' disease just means they are seeing in your blood work that your body has immune systems it's making, cells that are attacking and killing cells of your thyroid. But not all hyperthyroid patients have that. All right, so let's dive in. This is a published medical research journal online right now at pubmed.gov, which is housed and hosted by the NIH. Erythroid microRNA and oxidant status, oxygen status, alterations in L-thyroxine, levothyroxine, most commonly prescribed drug for hypo and hyperthyroidism. They gave this to hyperthyroid rats, and they wanted to find out if we give them this L-thyroxine for hyperthyroid rats, what happens when we give them selenium as a supplement? All of you have learned from me that there's three main nutrients required by everybody's thyroid in their bloodstream to make normal amounts of thyroid hormone. It's selenium, iodine, and an amino acid called tyrosine. But you don't necessarily have to supplement tyrosine. It's an amino acid found in most of the things we eat. But iodine and selenium, most of us are deficient in, and you need to supplement it. All right, so they're using selenium here. 48 Sprague male rats were divided into 6 groups. There was a control group. A group fed 0.5 milligrams of selenium, a group fed with 1 milligram of selenium, a hyperthyroid group, the hyperthyroid group fed with 0.5 milligrams of selenium, and a hyperthyroid group fed with 1 milligram of selenium. That selenium source is called sodium selenite, which is selenium and salt mixed. Sodium is salt. So sodium selenite, salt with selenium. Okay, let's keep going. All right. These rats' levels of thyroid hormones were increased in the hyperthyroid group compared to the control group, and the group fed with 0.5 milligrams of selenium. Glutathione, GSH stands for glutathione stimulated hormone levels were increased in the hyperthyroid group, and the hyperthyroid group fed with 0.5 milligrams of selenium compared to the control group. Now, glutathione is an antioxidant. It reduces inflammation in the body. You want higher levels of this. Glutathione stimulating levels of the hyperthyroid group fed with 1 milligram of selenium were decreased when compared with the hyperthyroid group, which means if you increase the selenium, it actually drops the glutathione, the stimulating hormone, down somewhat, which is better. You don't want too much of this stuff. Too much of anything is not a good thing. So they're trying to see if the normal hyperthyroid group has elevated GSH when they give it 0.5 milligrams of selenium. It just kept it high. When they gave it a more selenium at 1 milligram, it actually started bringing GSH back down. So they're trying to reduce inflammation in hyperthyroid rats. And these two things they're looking at are GSH, which is an antioxidant, and what's called SOD, which is superoxide dismutase, which is another thing that helps reduce oxidation and inflammation in the body. That's what we're looking at here. In fact, the next sentence is this: superoxide dismutase levels of the hyperthyroid group not treated were increased when compared with the control group. Similarly, SOD levels of the hyperthyroid group fed 1 milligrams of sodium selenite were lower than the hyperthyroid group. This is wonderful. You're seeing all these inflammatory markers and the antioxidants required to bring it down. All those things are coming down in level because the selenium is helping to improve the thyroid's function and health. It is helping to reverse the markers they look for that tell your medical doctor you have hyperthyroidism or not. Our findings show that MDA, SOD, and GSH, these antioxidants and hormones, levels increased and changed in the hyperthyroid rats. Supplementation of 1 milligram of salt selenium was more effective than 0.5 milligrams for normalizing MDA, GSH, and SOD, and these RNA levels in the hyperthyroid group. So if you want to improve inflammatory markers, reduce inflammation, the requirement for reducing inflammation with antioxidants, Supplementation of selenium is key. I'm going to show you what the dose is. At the Dr. Ardis Show, we have selenium in the form I'm about to show you at the exact dose in this next couple research studies that they were able to prove that selenium helps to rebalance a hyperactive thyroid. Oral selenium improved the disease activity in patients with mild Graves' orbitopathy. You ever seen the eyes of a hyperthyroidism bulging out of their head, almost like their eyeballs are coming out of their head? That's swelling of the eyeballs from hyperthyroidism and Graves' disease. All right, so these are people with hyperthyroidism with a small amount of antibodies attacking their thyroid, but they're definitely hyperthyroid. Each patient was randomized into one of two groups. Group A took a placebo tablet, which consisted of 100 micrograms of starch twice a day for 6 months. And group B took 100 micrograms of selenium tablets twice a day for 6 months. The patients from both groups were examined and evaluating using a CAS score before and after the first, third, and 6 months of treatments. All right, so let's break it down. There's two groups. They separated them. And you're going to give a group of people with hyperthyroidism and Graves' disease and their eyes bulging out of their head called orbitopathy. They're going to give them a placebo pill, half of them, that only has cornstarch in it. And they're going to take that twice a day for 6 months. And then they had another group that they gave 100 micrograms of selenium twice a day, which equals 200 micrograms a day total. And then they evaluated these patients every first month, third month, and 6th month after starting treatment. Let's read what they discovered. The results. Intergroup analysis showed statistically significant differences in the palpebral fissure and CAS score between the pre-treatment values and 6 months after treatment in the selenium group. I repeat, we saw improvements in everything we were measuring in hyperthyroid patients. We saw an improvement in the selenium group, not the other group that got starch. How much was it? 200 micrograms. This is the first study undertaken in Mexican population that demonstrates that oral supplementation with selenium decreases clinical activity, all symptoms that a person suffers from when they go to a clinic and then being diagnosed with hyperthyroidism, that is, decreases clinical activity. These people aren't suffering anymore. That makes them have to go to a clinic. That's why they call it clinical activity. And stops progression in patients with mild Graves' orbitopathy. Ask your doctor if selenium is right for you, all of you being told you have hyperthyroidism. Magnesium metabolism in hyperthyroidism and hypothyroidism. This is another mineral like selenium found on the periodic table of elements. All of us have been brainwashed since we were children to study and memorize was that periodic table of elements. These are the elements scientists have defined and found in nature that make up all of life on Earth and in the universe, including the human body. On that periodic table of elements is selenium and magnesium, two of which I'm showing you here can improve hyperthyroidism. And in this study, you're going to learn it helps improve both hypothyroidism and hyperthyroidism. God must have known what he was doing when we put magnesium in the soil. So it ended up in our plants and in our animals that eat plants that we eat. All right, so here we go. I want you to notice the date top left. This isn't new information. In fact, you all should be pissed if your endocrinologist hasn't told you about magnesium and hyperthyroidism and hypothyroidism. They've known this information since 1966. Well, how come we can find this and I can show you this? Well, your medical professionals act like they don't think any of this exists, and you only need Synthroid, levothyroxine, and those two drugs we just named for hyperthyroidism, propyl isouracil. In 1939, we're even going to go back further, Huber reported clinical improvement in patients with thyrotoxicosis, hyperthyroidism, after parenteral administration of magnesium. Nagoob reported a decrease in size of both toxic and non-toxic goiters. Goiters in the thyroid, you're only told to have to be cut out, removed, Back in the 30s, 40s, and 50s and 60s, scientists were able to show they could decrease the size of both toxic and non-toxic goiters. Let's just say growths or goiters in your thyroid, and clinical improvement in 3 thyrotoxic patients given daily injections of magnesium chloride. Ask your doctor if magnesium is right for you. 8 hyperthyroid and 8 hypothyroid patients were studied in this 1966 research study. by determining the blood level of magnesium, exchangeable magnesium, and total balance of magnesium studies. Hyperthyroid patients were found to have decreased blood levels of magnesium and increased excretion of magnesium in their urine. And normal total and cellular exchangeable magnesium before therapy. So you see excess magnesium leaving the urine. You see low levels in the plasma or in the blood of these patients, all those with hyperthyroidism. Ask your doctor if magnesium is right for you. It has been known since 1966. Those with hyperthyroidism and hypothyroidism have low levels of magnesium, and it improves when you give it to them. Here's the next study, even newer study. This is 2014. The WOMED model of benign thyroid disease. Acquired magnesium deficiency for those with thyroid diseases. They have an acquired magnesium deficiency due to physical and psychological stressors. And that relates to dysfunction of oxidative phosphorylation, increased oxidative stress on the entire body. The aim of this study was to discern whether there's a relationship between biochemical parameters, blood markers, sonography using a sonogram, and musculoskeletal data exist in cases of hyperthyroidism. And whether they are modifiable, can you change all these things with a sonogram, blood markers that you're reading on a blood test? Can it all be modified through supplementation with selenomethionine and magnesium, as well as by acupuncture and manual medicine methods? So now this study, they're like, look, we've looked at all the research studies since 1939. We're going to test selenium together with magnesium this time, and maybe some acupuncture, and let's see if regular medicine also helps. Increasing levels of stressors are associated with decreased levels of magnesium. If your life is stressful, you're losing magnesium faster than anybody else. Increasing levels of stressors in life are associated with decreased levels of magnesium in the blood, whereby patients with hyperthyroidism have the lowest levels as compared with cases of hypothyroidism. Those with a over-functioning thyroid have lower levels of magnesium than a low-functioning thyroid patient or sufferer. Together with this biochemical alteration, we document increased levels of vascularity within the thyroid. On the therapeutic side, we have demonstrated a beneficial effect of combined supplementation regimen based on 200 micrograms of selenium and magnesium citrate 3 times a day over a period of 3 months on thyroid function and on the intensity of thyroid vascularity. How much blood flow is going into the thyroid and how much of those hormones are leaving the thyroid. Within 3 months, we see a massive improvement using just 200 micrograms of selenium and magnesium citrate. Now, just so y'all know, my magnesium complex at the Dr. R Show also has magnesium citrate in it because it's so good. The final clinical settings would be, number 1, hypothyroidism. They have low magnesium levels with low iodine uptake in their diet and low need of muscle repair. Hyperthyroidism patients, they have low magnesium together with inefficient oxidative phosphorylation, being able to remove antioxidants, those are things that cause radical damage in the body, and an increased need of muscle repair due to pronounced musculoskeletal changes, such as what they called lateral tension and abbreviated IMT. If you want to know what that IMT is, go click the link below on the screen and go read that research study. Magnesium and selenium. First 2 things, every hyperthyroid patient, it is known you have low levels of in your blood, and that correlates directly to your symptoms. Now let's dive into vitamin D. This is the effect of vitamin D3 on untreated Graves' disease with vitamin D deficiency. And this is going to be one of my favorite things to talk about in this discussion because of what research scientists have published about vitamin D and Graves' disease, which includes hyperthyroidism, which we're talking about today. Graves' disease is an autoimmune disease characterized by hyperthyroidism secondary to circulating autoimmune antibodies that are attacking your thyroid. Auto means self in Latin, self-fighting antibodies. Your body's destroying itself. It has become apparent that multiple factors contribute to the disease process development of Graves' disease, including genetic and environmental factors. The pathophysiology, the disease process of Graves' disease involves the infiltration of T cells, your immune cells, in the thyroid gland, These activated T cells, called thymus cells, in turn increase the secretion of thyroid specific autoimmune antibodies from B cells. They're explaining to you how it is that T cells and B cells create this scenario of autoimmunity in Graves' disease patients. The prevalence of vitamin D deficiency was reported to be common in patients with Graves' disease, which includes hyperthyroidism. The role of vitamin D has been investigated in several studies. The first one mentioned here is the first author of the study is Mishurin, observed that vitamin D deficiency was found to modulate or correct Graves' hyperthyroidism induced in mice by thiotropium receptor immunization. They injected with the vaccine mice with a drug that caused it to be hyperthyroid, and they reversed it with vitamin D. In this study, these mice on vitamin D deficient diet were more likely to develop persistent hyperthyroidism than other mice receiving adequate vitamin D supply. This is a reference back to a previous study done on vitamin D in mice. In another study they're referencing, combination treatment with methimazole and vitamin D3 in patients with Graves' disease has a more rapid euthyroidism achievement. Now, I want y'all to stick with me here. I like making sure everybody understands what you're reading. Euthyroidism has a definition. I'm about to show you what it means, but please pay attention to this study's first statement highlighted, underlined right now on the screen. In this study, combined treatment with the most prescribed drug for hyperthyroidism, I just showed you, methimazole, and vitamin D together in patients with Graves' disease has a more rapid euthyroidism achievement compared with patients who just received the drug alone. I'm going to show you the definition of euthyroidism here in just a second. In addition, vitamin D supplementation has been shown to inhibit inflammatory responses in human thyroid and T cells. Has your medical doctor, who's told you have hyperthyroidism, told you to take propyl-isouracil or to take, it's propylthiouracil, or to take methimazole, have they told you that you need to supplement vitamin D with it? Because it's been found in research studies using these drugs that patients on the drugs alone don't do as well as those who take the drug and take vitamin D. So at a bare minimum, you should be taking vitamin D even if you're on the drug. Interestingly, vitamin D deficiency is found to be associated with higher thyroid volume in patients with newly onset Graves' disease. If you have low vitamin D levels, your hyperthyroidism is worse. It has been recently discovered that vitamin D receptor genes and vitamin D binding protein gene polymorphisms are associated with Graves' disease. All right, so let's go back up to the first highlighted, underlined sentence right now on the screen. In another study, combining treatment with methimazole and vitamin D3 in patients with Graves' disease, which has hyperthyroidism, has a more rapid euthyroidism achievement compared with patients who just take the drug. Well, let's show you what it is. Well, it didn't actually show you. That's on the next slide. I'll show you here in just a second. Our present case supports the current literature and strongly suggests that vitamin D deficiency may exacerbate the onset and the development of Graves' disease and correction of vitamin D levels, of which may be able to reverse it. Vitamin D may be able to reverse it all by itself. Now, I want to show you this because it's important. Euthyroidism, you're going to see the definition here in a minute. It must be in a different research study. I have multiple in here. This is from the Cleveland Clinic. I have to show you this. I had to throw this slide in right before I did this. If you look under the management and treatment section of the Cleveland Clinic's write-up on Graves' disease that includes hyperthyroidism, they say the first sentence is here, how is Graves' disease treated? I want you to read what it says. Graves' disease is a lifelong chronic condition, meaning once you have it, you ain't ever living without it. You're going to have it your whole life. Now, I want you to look down on the screen at the blue highlighted area. You'll see treatments for Graves' disease include. Now, this is from the Cleveland Clinic. I want you to look at those things that they listed there. Beta blockers for hyperthyroidism and Graves' disease, anti-thyroid drugs, which you see methimazole and propylthiouracil, which we've already discussed here. You'll see radioactive iodine therapy to kill your thyroid or surgery to remove your thyroid. Of all the 4 bullet points you see on the screen on Cleveland Clinic, where do you see vitamin D? Where do you see selenium? Where do you see magnesium? I'd like to know why Cleveland Clinic hasn't read its own research. This is medical research, people. The retired chiropractor cannot be the only one that knows how to read English and knows how to read scientific papers. Come on. They've already been figuring this out for years. Ask your doctor if vitamin D, magnesium, and selenium are right for you. Now, the reason why I put this up here is this is what's on the Cleveland Clinic's website right now about the only options for treating a lifelong condition, they're telling you. Lifelong, you can't get rid of it. Well, look at this. I'm just going to remind you from the previous study, this was their conclusion. Our present case supports the current literature and strongly suggests that vitamin D deficiency may exacerbate the onset, or it can be implicated in the development of Graves' disease. And correction of vitamin D levels by supplementing with vitamin D or getting vitamin D out in the sun may be able to reverse it. It being Graves' disease. It being Graves' disease that also includes hyperthyroidism. Ask your endocrinologist at the Cleveland Clinic if vitamin D is right for you. Here's 2 cases of hyperthyroidism treatment with homeopathic remedies containing herbal extracts from Lycopus and Melissa officinalis. Now, don't get too caught up on these fancy scientific words. These 2 words are essential oils extracted from 2 plants, the Latin names of which you see in the title, Lycopus and Melissa officinalis. Melissa officinalis is what you are most commonly aware of is called lemon balm extract. The Lycopus is called bugleweed. It's a plant. These just happen to be the scientific names given to them. We're talking about hyperthyroidism here. A 64-year-old woman presented for routine examination and was found to have a TSH, thyroid stimulating hormone, of 0.01 milli-intra-units. On June 6, 2016, labs the next month showed those numbers. TSI was elevated to 275%. That should read TSH was elevated to 275%, consistent with Graves' disease. She did not have symptoms of hyperthyroidism. So she has elevated TSH, or actually, she should have low TSH. This is too low. Got it. All right, here we go. The patient's cat, this is what I find funny. They're going to talk about the cat. The patient's cat had been treated for hyperthyroidism with some product called Thyrosoothe, a formulation containing 2 extracts from bugleweed and lemon balm. So she's giving her cats this little natural substance supplement with lemon balm and bugleweed in it. After the patient was diagnosed with hyperthyroidism, the patient began taking this formula that had lemon balm and bugleweed combined. On 9/12/2016, so 3 months later, the patient's labs were improved with the TSH almost doubling and the total T3 of an 86. 3 months later, the patient's TSH was 1.89 with normal free T4 hormone, total T3 hormone, and TSH. She took the combination of lemon balm and bugleweed for 9 months. Her thyroid function tests have remained normal since starting these 2 combined nutrients without the need for any other anti-thyroid drugs. Have your endocrinologist who treat your loved ones for Graves' disease and hyperthyroidism, have they yet to recommend lemon balm and bugleweed to you, these 2 plants? She started taking this when her cat got cured of a thyroid problem. She decided to take it herself. Isn't that amazing? I find it amazing. Here's the next case. A 46-year-old female presented with periorbital edema, swelling of the eyes bulging, in July 2018 and was referred to an ophthalmologist, eye specialist, who diagnosed her with a thyroid eye disease. She was also complaining of palpitations and jitterness. She was found to be hyperthyroid on labs and was treated with methimazole between August of 2018 and February 2019, so for a total of 5 months, requiring doses of up to 10 milligrams several times a day. In March of 2019, she stopped taking methimazole due to transaminitis and began taking a thyroid tincture containing bugleweed and lemon balm extract. She has remained euthyroid. This is the term I thought I had this slide for earlier in the presentation. I'm going to show you the definition right here. She has remained euthyroid on the herbal tincture. Her transaminitis has resolved, and she has not required any further anti-thyroid drugs. Her TSI, which was 0.84 in May of 2019, normalized to 0.31 in June of 2020 after 15 months on this tincture, which she is still taking, as you can read. What is euthyroid? These people are taking lemon balm and bugleweed in combination together. What is euthyroid? Sorry, I didn't put it up earlier in the screen. I thought it was early in the presentation. Euthyroid, by definition, means having normal thyroid function. So if we go back and read this sentence above, in March 2019, she stopped taking methimazole, which is the drug most prescribed for hyperthyroidism in Graves, due to a condition called transaminitis, and began taking a thyroid tincture containing bugleweed and lemon balm extract. She has remained euthyroid. She has remained having a normal thyroid function on the herbal tincture to this day and has not required any further anti-thyroid medication. I quote, as your medical doctor recommended to you, vitamin D, selenium, magnesium, bugleweed, and lemon balm for your hyperthyroidism. Have they told you might even not need your drugs ever again? That cause jaundice, liver failure, kidney failure, and the like, and death, as I showed you. In lab and rat studies of bugleweed and lemon balm extract have demonstrated anti-thyroidal effects. This is the first report of the use of these plant extracts in the treatment of 2 patients with Graves' disease, in whom it led to restoration of euthyroidism and normalization of TSI titers, which is what they use to diagnose hyperthyroid patients. Well, if you're excited about this information and you would like to know where to get the antidotes I'm recommending to you, if you don't want them from us, it's fine too. But here's our vitamin D3. It has 5,000 international units per capsule of vitamin D3. And yes, I recommend it to you. If you have hyperthyroidism, I recommend vitamin D3. This comes from a plant extract. Here's magnesium. You'll see 400 milligrams of magnesium in our 4 capsules there. This is the magnesium I take every day. It's a combination of magnesium citrate, you'll see there, aspartate, and malate. Then our selenium supplement, and you can read there, 1 capsule has exactly the 200 micrograms that were in those studies they used to reverse hyperthyroidism. And the exact form of selenium, called seleniomethionine, is the exact form I have in our Nature Wins selenium supplement, 1 a day. Now, I want to show you lemon balm extract source. This would be mountainroseherbs.com. They have a organic lemon balm extract. You're just going to take the dosage on the bottle as they recommend in dropper form. Put it in drinks, put it in your mouth. It doesn't matter. And then this is a source of bugleweed extract. If you wanted to combine your own or take these yourself, you can get this at hawaiifarm.com. Farm being spelled like pharmaceuticals. hawaiifarm.com, PHARM.com, bugleweed extract. Remember, not everything you're going to hear from your medical doctor is absolute, all-encompassing, all-comprehensive when it comes to any health condition whatsoever. Thank you for hanging out with me today, learning about hyperthyroidism and 5 simple things that are made and found in nature that can help you reverse those scenarios, and has been proven to do so even in real-life patient studies for humans. Scan the QR code if you want to be alerted when our next presentation will be. And this is our book. Scan the QR code. You can go get it now at thedrardisshow.com. It is available in Audible form at amazon.com. You can also buy the book at Amazon. And there's also a print-on-demand Spanish printed paper version of my book for those of you who want to read it and study in Spanish. The lessons I learned during COVID-19, the pandemic, were life lessons that are going to be applied to all future viral pathogens, viral pandemics. They're going to continue to vomit on us, are coming around the world. And I couldn't be more proud of the actual reaction around the world to the book, Moving Beyond the COVID-19, Restoring Your Hope and Health for Humanity. I'm Dr. Ardis, and we will see you next time on the Dr. Ardis Show next week. God bless you. Have a great day. I love you, and I'm grateful for all of you.
Disclaimer, please note, the following presentation is solely for informational purposes and should not be seen as a replacement for advice provided by your physician. It is important not to rely on the information from this presentation for diagnosis, treatment, medication prescription, or any other form of medical care. Always consult with your physician or healthcare professionals before taking any medication, nutritional supplement, herbal remedy, homeopathic treatment, or pursuing any health-related procedure. If you have a medical condition or believe you might have one, promptly contact your healthcare provider. Do not disregard professional medical advice or delay seeking it based on this presentation's information as the products or services purchased from it. Do not establish a doctor-patient relationship between you and any affiliated physicians. Statements about dietary supplements have not been evaluated by the Food and Drug Administration and are not intended to diagnose, treat, cure, or prevent any disease.